Hey folks, again, welcome. I'm Dr. Mia, a gastroenterologist in Lake Jackson, Pearland, Houston area. As the year comes to an end, I wanted to reflect upon my specialty, what happened, how the humble beginning has brought us to this point. I started my GI fellowship in 1992 and finished my GI fellowship in 1995. But some of the pivotal thing that happened is during this time, I have been very lucky and fortunate. First, the first proton pump inhibitor, omeprazole or Nexium, was introduced in 1989 when I was in second year of my residency training. Although it was introduced, it took a couple of years to ramp up. And during my GI fellowship, we saw a dramatic change. Ulcers in the esophagus healing in a shorter period of time. People who couldn't sleep due to bad reflux and pain of the esophagus now have been able to sleep. The ulcers in the stomach or in the duodenum that was not healing, now healing better. It makes me so grateful to think about those changes. And another big change that I saw is people who had narrowing or dysphagia or difficulty of swallowing due to narrowing of the esophagus. Some of the people needed stretching almost every other week, but now with the help of Nexium, people were able to last longer. They needed less number of procedures. Another pivotal thing happened was in the arena of hepatitis. We didn't even know at that time hepatitis C. We used to call them hepatitis non-A, non-B, because all we knew that we are dealing with a hepatitis or a liver disease that is not due to hepatitis A or not due to hepatitis B. So we called it hepatitis non-A, non-B. And in 1991, once we shortly before recognized that this is a new disease called hepatitis C, a completely different virus. Then in 1991, the first treatment of hepatitis C with interferon was approved, but the success rate was only 5 to 10%. Still, a lot of people were willing to go through this, and it used to make them sick like a sick puppy. People were suffering from depression. The side effect was so hard that in spite of their attempts, almost half of the people could not continue. Compare that today. Now hepatitis C is not even a shot. It's just oral pill for 6 to 8 weeks, and almost everyone gets cured. I just think about these things and I become so grateful and so humbled from where we came. You take care.